started Ally in 2017, and it was a group of local physicians who started the company. And so everyone who works at Ally in the emergency room, all of the physicians are owners of the facility as well. And so we started it because there was a big need that we saw in terms of how sort of people are being treated in hospitals. No surprise, I think, to a lot of folks that people don't want to go to the ER in general, not just because it's a scary place, but because you get put in a hallway bed and you wait for 4 hours and you're treated by a doctor who's rushed because they have 10 other things that they have to do. And so it's really not the ideal environment, and there was a big need we saw for a place where you could come and actually spend time with the physician, where you didn't have to wait, where you can get tests back quickly. So that sort of inspired the creation of Ally, and so we have a facility here in Round Rock, and we actually have 3 others in Austin and 2 in Houston as well. This is a place where we, as the physician owners, really take pride in the fact that we can staff it appropriately, where we have essentially no wait time for folks to come back, where we can actually sit and spend time talking to patients, and we don't have 10 other things that we have to do because we can, have enough people to see everybody. People tend to like coming here because of that. We tend to really like working here because of that. And so that was sort of the beginning of Ally and kind of how we've grown. We differ from hospitals in a couple ways. At first, how we're similar is we have all the same sort of capabilities, CT scans, ultrasounds, labs, all of that's on site. We have 24 hours certified emergency physicians, nurses, etc. We can admit patients here for periods of time for antibiotics and things like that. How we differ from a hospital is we don't have all of the sort of other stuff, the operating rooms, the many different specialists and things like that. When someone comes in and they may need that, we can diagnose them, we can treat them, and if they need, for example, emergent surgery or something like that, we can coordinate with a hospital. We have partners with all the local hospitals, and we can coordinate to get you directly admitted to the hospital and kind of have that surgery or whatever it is that they need there. More importantly than that, though, how we differ from the hospital is that we, as I alluded to before, take pride in the fact that we're not making people sit in hallway beds. We're not having people sit in the waiting room for 4 hours. Fortunately, the staffing and the facility and the ability to get people back immediately, oftentimes check into the emergency room and don't have time to fill out the paperwork, you would need to come back to the room. Nurse comes, the doctor comes, sees you within a couple minutes. They spend a lot of time with you. They can spend a lot of time with you because they don't have so many other things that they have to do. The culture here is also a little bit different. It's really a breath of fresh air to work at our facilities, because so much of what the hospital ERs have been is this culture of having to run through patients again and again and again. It's really nice to be able to sit down and spend time with folks and actually make sure that all their questions are answered, that you can really take care of them. People seem to leave very happy as well. And the doctors and the nurses have the ability to spend a lot of time with you. They're not just saying hi and are you okay and then what's your pain score and going out the door. They're actually spending time with you, whether it's 30 minutes or 40 minutes or whatever, trying to answer all of your questions and try to ease your discomfort. From the billing side of things, we try to simplify that as much as possible. You will never get a surprise bill from us. You won't get a bill from anybody like a radiology group or this or that or other specialists or anything like that. It's very straightforward, it's very simple. We bill insurance, and then we try to minimize whatever cost there is to the patient as much as possible as well. So one thing that we also do is a lot of community outreach, so it's important to us to be members of the community and to be an integral part of the area we're in. Community outreach activities, you might see us at Friday night football games, or you might see us at a first aid tent at one of the festivals in downtown Hutto. And so we try to be as involved as we can with the community, as well as kind of being a resource for folks here as well. Contact us several ways. You can go on Google or Google Maps and just type in ER or closest ER or Ally Medical Emergency Room. You'll find we're the ones with the most 5-star reviews. Also, call us. We have a website that you can message us directly. We'll respond to you back in an email, text message, call, usually within a couple minutes. You can contact us via, there's a portal that we have as well. And so there are many ways that you can get in touch with us, and we fortunately have enough staff that we can reach back out to you and answer your questions pretty immediately.